have been working very closely with Joan Millen McKenzie, who, again, you all know very well. As a breast cancer survivor and also having lost her dear aunt to breast cancer, Joan is very passionate about helping to bring an end to the suffering by those of us who have been unfortunate enough, or fortunate enough in some cases, to be touched by breast cancer. We at the Canadian Breast Cancer Foundation are very grateful, not just to have Joan's support, but to have her at the helm of Trucking for a Cure. Each year, I am so very touched by the support we receive from Trucking for a Cure and from all of you wonderful people. Over the past 3 years, Trucking for a Cure has raised over $130,000 on behalf of the foundation. So if So this year alone, 2012 that is, with your help, Trucking for a Cure raised over $56,000, and we're still counting. Yeah. Yeah. Our fiscal year is the end of March, and Joanne always asks that we leave the event open for those who would like to still give great donations. So we are really grateful for that. I am sure that most of you are familiar with some of the work, or all of the work, that we do at the foundation. However, I'd like to tell you just a little bit more about how your support is helping to create a future without breast cancer. The Canadian Breast Cancer Foundation was founded in 1986. It is the largest non-governmental funder of breast cancer research in Canada, and one of the largest in the world. Our work is done in 3 very important ways: through research, advocacy, and the promotion of health education and awareness. In terms of research, we fund relevant, innovative research across the breast cancer continuum, and that goes from prevention, early detection and diagnosis, to treatment and survivorship. In terms of advocacy, we are very passionate about the work that we do and the role that we play in advocating on behalf of those affected by breast cancer, particularly as it relates to improvements in treatment and care. So in terms of that, we constantly lobby the government for improvement. And I don't know how many of you might know, but like previous to now, the age for women to automatically be able to get mammograms was 50. And we lobbied the government for years to try and get that down. And now we have been fortunate to get it down to 40. And we're still working on this because we have a lot of young people who have been affected by breast cancer. You have people in their 20s. As a matter of fact, in fact, in a week from now, I have this event at one of the schools that I oversee, and we have a student who found out on the night before her prom that she had breast cancer. So her teacher has picked up the cause, and they are having an event next week, and they're also taking this to Off-Broadway in New York. So I mean, on one hand, it's so fantastic that he has picked this up and we're having this kind of awareness. On another hand, it really sucks that any of us should be affected by breast cancer. But imagine what a 16, 17, 18-year-old has to go through. Thirdly, we promote health and education awareness by acting as a resource in breast cancer education and awareness. And you can always visit our website to get more information. You can speak to any of our staff, and you can always get resources in terms of books and other pamphlet, brochures, etc. from us. Since 1986, we have awarded over $93 million to more than 600 research and fellowship projects in Ontario. This is only possible because of events like Trucking for a Cure. Today, research funded by the Foundation has led to advancement in screening, diagnosis, and treatment, contributing to more than 40% decrease in the number of women dying from breast cancer since 1980. So that is something we are very, very proud of, a 40% decrease of women dying from breast cancer. And I want to pause just to say this, because we talk a lot about women dying from breast cancer. A lot of women are living with breast cancer or have been able to survive breast cancer. But not only are women affected by breast cancer, 1% of men are also affected. So you're not exempt. As a man, you're not exempt. So we have to be each other's keeper. We all have to be partners in this fight. Women, men, children, because breast cancer affects all of us, especially our families. I'd like to tell you about two of the research projects we have funded. Dr. Peter Lovrix at McMaster University is being funded in the area of breast cancer treatment. Dr. Lovrix is studying a technique to improve the accuracy of surgery using tiny radioactive pellets. The insertion of these pellets into the breast could enable surgeons to more precisely remove all of the cancer from the breast, potentially preventing the need for additional surgeries and possibly reducing the recurrence. And we're very excited about this. Another example is a scientist, Norman Boyd, at Princess Margaret Hospital. He's studying in the area of prevention. Dr. Boyd is one of the scientists who first identified breast density as a risk factor. Research supported by CBCF has allowed him to continue to explore the relationship between density and risk, including risk assessment earlier in young women based on their mother's breast density and other risk factors. In 2013, breast cancer continues to be the most common cancer in women over the age of 20. And notice we said 20, not 30 or 40. With 1 in 9 expected to develop breast cancer during her lifetime, and 1 in 29 expected to die from it. I'm sure most of you here know someone who has been touched by breast cancer or currently battling with the disease. A friend, family member, or colleague. In fact, right here in our midst, a very dear friend, Bob Taylor, is undergoing treatment for breast cancer. And most of you know Barb. Barb, just know that we are with you in thoughts and prayers, and we know that you will get through this. We're all rallying around you. On behalf of CBCF, I want to thank each of you for your ongoing support. A special thanks to Joan Millen McKenzie and her team of hard-working volunteers for your ongoing support and dedication in putting on this event year after year. Special thanks to each of you, sponsors, supporters, all the people that I've seen year after year. And we'll go through, because we do have some presentations to make this afternoon, so I'm just happy that you're all here and that we get to spend this time together. So once again, thank you. Let's continue to work together to create a future without breast cancer.